Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope this episode finds you doing well. I hope you had a wonderful Thanksgiving, and I hope you had lots of food, whatever you eat on Thanksgiving. If you're vegan, whatever you had for dinner, if you had turkey, ham, whatever, cranberry sauce. Personally, folks, I enjoy cranberry sauce. I'm the only person in my family that actually eats it. That I'm aware of. So every single Thanksgiving, we always have Thanksgiving, like I told you, at my parents' house. And every single Thanksgiving, whether that's ordered or made or whatever the case is, cranberry sauce is provided for me specifically. I'm the only person that eats it. I mean, maybe someone else might have a nibble or anything, but no one actually really wants it but me. So I'm the only person that it's made for. Whatever it is that you ate, and however you may be listening to this, I hope you had a fantastic holiday with friends, family, whoever you had it with. I hope it was blessed. Thank you for tuning in to episode 129 of the Everything Medicare Podcast, and I have a doozy for you today. I have ran into this a lot, but I was actually inspired to make this episode, and I have to give her a little bit of a shout out by Joanna Wyckoff, who came on and was gracious enough to be interviewed on this platform about a couple of weeks ago. So if you don't remember that interview, or maybe you missed it, Joanna was in the Air Force. Joanna was a claim specialist with Social Security for nearly a decade, and then she transitioned into being a Medicare agent. And so she has a unique perspective. And I saw her, mention something that really, really jumped out at me, because it's something I've seen tremendous amounts of times over the years, and for some reason it just hadn't crossed my mind to do an episode about it. But she basically mentioned that she encountered somebody through her travels and her work that was, of course, a beneficiary in Medicare. It's who we work with. Joanna's a good agent. There's not a lot of good agents out there, but Joanna's a good agent. And she worked with somebody that was basically paying $49. I think, if I get the facts of it wrong, if she's listening, or whoever's listening, forgive me on this, but basically the consensus was, I can't remember if she was paying a $49 premium and she had the option of getting a $0 premium, or she was paying $49 too much for a plan that she needed to pay for. But whatever the case was, she was able to save her $49 a month premium on her Medicare Advantage plan. And not only did she save her $49 a month on her Medicare Advantage plan, it was a better plan. It was better benefits. It was a better situation for the client to be on. And she asked her how she got on the plan, and the person responded with, and I quote, "It was a volunteer that helped me find this plan. A volunteer. A volunteer. I have news flash for you, folks. A volunteer is not a Medicare expert. No! They're not. I've heard this all the time in my years of doing this business. I've heard people say, where I got this plan recommended to me by my neighbor helped me, or my kids helped me, or my brother helped me, or a volunteer helped me. A volunteer of what? What? A volunteer of what? Are they a professional? Is your friend a professional? Is your family member a professional? Is your neighbor a professional? I've been preaching about this for years, but I had to make an episode about this because it just really inspired me, jumped out at me, because I've seen a lot of people get screwed over by working with a quote-unquote volunteer. That volunteer was costing this individual anywhere between $550 to $600 a year in additional premium for a worse plan than, because they're volunteering, And she made a great point. You wouldn't go to a volunteer to do your taxes for you. You'd go to a CPA. You want to go to a professional. Does a volunteer know tax law? No! Would you go to a volunteer if you broke a bone? No, you'd go to a doctor. Why is it when it comes to insurance, people think they don't have to work with professionals to get good advice and consultation? This person, it was light compared to some things I've seen over the years, but they go to volunteers to get consultation on their insurance, and they end up paying a tremendous amount in premium, claims, not having things covered they need covered, like medications, dental, vision, hearing, whatever the case might be. More commonly, they're probably paying through the nose in premium for something they could get better coverage on for cheaper, because in the Medicare world, you don't always get what you pay for. I'm sorry, folks. Whether it's a Medicare Advantage plan, whether it's a Medicare Supplement plan, you can get, folks, the same exact Medicare Supplement plan for double the premium from one insurance company to another. It's a fact, okay? It's a fact. Medicare Supplement plans are standardized. Let's use a Plan F, a Plan G, a Plan N, for example. You could literally get the same plan, no difference in coverage, from one insurance company to another for $100 more a month. You don't always get what you pay for. Does a volunteer know that? Probably not. A volunteer can't help you as good as a professional could in anything. Taxes, medical advice, Medicare health plan. I'll be back in segment 2, folks. I have a lot more to get off my chest and I need to say about this. And this episode is basically going to be me ranting, riffing. And I know some of you love that. I know some of you hate it. But if you hate it, too bad. Okay? This is something that I need to get off my chest. I have to make sure that this is said. Because if people like Joanna don't say this, and if I don't step up and have the courage to say it, who will? Don't go anywhere. I'm going to take a break. Hear from their sponsors. I'll be back in segment 2.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare Advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Folks, would you have a volunteer build your house for you, or would you have a contractor? Ask yourself this. This is how ridiculous this is to me. This is a ridiculous topic that I feel like it's ridiculous that I even have to say something about this. I really do. I think it's outrageous that I even have to talk about this. Folks, I know every single one of you that's listening are smart people. You know this stuff. You know. And if you're listening and you're the person that got enrolled in your Medicare health plan because, some social worker or maybe a Social Security worker recommended it for you. Joanna Wyckoff, who worked for Social Security, came on this podcast, did an interview with me, and said that they don't teach them hardly anything about how Medicare works. They just know how to enroll them into it. That's somebody that worked for the Social Security Administration for 10 years. Those people don't know anything about Medicare. Hardly anything. Why would you go to them to get enrolled? Why would you go to a volunteer? Why? Come on now. Ugh, this is so frustrating to me. It really is. I mean, if you want to know why I'm losing my hair, it's about stuff like this. Because it never turns out good for the person. I'm not trying to get mad at anybody. I'm not trying to yell at anybody. But it never turns out good for the person in question. Joanna put it very, very eloquently with what she said that inspired me to do this episode. She said that this quote-unquote volunteer cost this person $500+ a year in additional premium for a worse plan. Yeah, thanks a lot, volunteer. Your volunteer work did a great service to the community. Not. I would not, try to perform a surgery on somebody as volunteer work. You see how ridiculous this is? You see how outrageous this is? I wouldn't volunteer to go try to be a police officer because I haven't been trained. I'll just get in the way of the other police officers. Get myself killed. Not help anybody. At that point, I'm a liability for the other police officers. If I'm going to try to help stop a bank robbery and I've never been trained like the police officers have, I haven't been through the police academy, am I going to get in the way or am I going to help? Are the police officers going to have to... let's say there's hostages in this bank robbery. I'm another person for them to babysit because I haven't been trained. Right? I'm another person that they have to keep an eye on. I'm another person that's going to get in their way. I'm another person they have to worry about being grabbed and made a hostage. I have no business participating in this. Why is this any different? Why? Would you go to a volunteer for your financial planning? To know what stocks to invest in? This is how ridiculous this is getting, right? It's ridiculous. Ridiculous. Would you have a volunteer look at your dog if your dog's sick? No, you take them to a vet. Use professional help and advice on these things. Because it never works out in your favor working with anybody that's not a licensed professional. And I hate to say it, the reason why you need a licensed professional is because this stuff is freaking complicated and confusing. There's a lot of working parts. There's a lot you need to know, and there's a lot you need to take into consideration and needs to be accounted for when making a selection for you. A lot. A licensed professional is the only way. I hate to say it. You're better off with a licensed professional than anybody else. Now, are all licensed professionals created equal? No, and I know that makes it hard for you. I know that makes it confusing for you because you don't really know who to talk to at that point. But I've done episodes in the past. I've told everybody. I've preached into the ground exactly what you need to do to find a good licensed professional from a bad one. There's methods. There's a method to my madness. There's a method to the madness of this. There's a way around this stuff, folks. But the last thing you ever want to do is work with a volunteer or somebody like that. Because they just don't know what they need to know. They're great people. Their heart's in the right place. They're trying to help people out. But they don't help people out any more than I would help out trying to help the police stop a bank robbery if I haven't been trained. Or if I try to perform a surgery on you instead of a doctor because I'm volunteering. Or if I try to do your taxes for you, if you have complicated taxes, tons of business write-offs, you own a business, I'm going to screw it up for you. And then you're held liable because you didn't pay your taxes, right? Just because someone's heart and is in the right place, just because they have the best intentions, doesn't mean that they're qualified. Think about it, folks. Think about it. I really, really hope that somebody hears this that really needs to hear this message. Work with a professional. Work with a licensed professional. You know what people have to go through to get licensed? They have to take a test. They have to make sure they're taking certifications, continuing education, paying fees. It takes a lot to be licensed and appointed and being able to represent insurance companies and being able to talk about this stuff on an intelligent, intellectual level. People have to go through some hoops. People kind of have to go through the ringer. So, a volunteer does not. A volunteer is just Google searching. Don't do it. I highly encourage you. Work with a professional. You'll be better off for it. You can listen to what your friends have to say. Listen to what they have to say. Take their experience into consideration. It does matter. But you don't want to solely make your decision based on a friend's or family member's recommendation. And by no means a volunteer. That just makes me nauseous when I heard that. A volunteer. I'm going to take a break before the rest of my hair falls out. I'll be back in segment 3. Excuse me. I'm so upset. I forgot what segment we're in. I'll be back in segment 3 after a quick word from our sponsor. Don't go anywhere. I have more to say about this to close out this episode. Don't go anywhere. Welcome back, everybody. Thank you so much for sticking with me all the way to the end here. There's not a whole lot for me to say about this, but it's something that needed to be addressed by not just one person. I completely, fully support anybody that speaks out against people working with anything less than a licensed professional, because you would not do that for anything else in your life. Like I said, you wouldn't go to a doctor, you wouldn't go to a volunteer that's never been to medical school instead of a doctor if you need to have a medical emergency. You would not go to a volunteer instead of a licensed certified CPA to do your taxes. Your taxes are simple. You might be able to do them yourself. That might not be a great example, but you get my point. You wouldn't go to a volunteer instead of a vet if your pet needed medical assistance. At least I hope you wouldn't. You wouldn't go to a volunteer. You wouldn't call a volunteer, I should say, if someone's breaking into your house, trying to harm you or your family. You'd call the police. Trained policemen. Right? Think about this, folks. Think about how silly this is. Think about how unbelievably ridiculous that this conversation is. But it is one that needs to be said, because far too many people put themselves in bad situations because they're working with people that aren't licensed professionals. Licensed, appointed, trained, certified professionals. Keep it in mind. Keep it in mind. Thanks so much for listening, folks. I really, really appreciate it. Shortly here, we're going to be licensed in 7 states across the United States of America. We're adding more all the time, but the states that we'll be licensed with to work with you on your Medicare, currently we have Utah, Idaho, Oregon, Texas, Florida. Again, that's Utah, Idaho, Oregon, Texas, and Florida. We can do a plan for you right now. We can compare your plan, see if there's anything better before the enrollment period ends. We have about a week left. It's not too late. If you weren't waiting until the last minute, now's the time. My office number is 801-255-5340, 801-255-5340. Give me a call. Let's talk. And shortly, might not be in time for the enrollment period, but South Carolina and Colorado. We're adding those states right now. We're in the works. But it takes time to get into a state. It takes time. Not only do we have to get licensed, I have to get licensed myself as an individual. Then my company, Christian Brindle Insurance Services, has to get licensed. So that way our organization can do business there. Then we have to get appointed with all of the various insurance companies that we want to work with there. We have to look who's there. We have to research, study, get information about the market, and determine which insurance companies we have to carry there. We try to get as many as we possibly can. And it takes time for all of this stuff. So I appreciate your patience for anybody that's listening. But we will have Colorado and South Carolina very, 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 very soon. Thanks so much for listening, folks. I hope you got something out of this episode. And I'm sorry to just rant and riff on you. I know some people love to hear me do that, but some people detest it. I hope that you got something out of it, and I hope you heard me. I hope you heard my message. And I just encourage you. I'm not telling you every single person to work with me. If you don't want to work with me, if you listen to our podcast for some time and you just don't like me, and you don't want to work with me, that's fine. But that doesn't make me wrong. Work with somebody that you like. Somebody. Have a great weekend, folks. Thank you for listening. Thanks you for tuning in. I'll be back with you Monday, and we'll have a podcast for you. Last week of the enrollment period. We're going to finish out strong with some great content. Take care now.